been 2 whole months since the House passed critical legislation. The Senate has failed to follow our lead and to provide certainty to struggling American families. Over 50 million people, let me say that again, over 50 million Americans have filed for unemployment benefits since the beginning of the pandemic, which would have been an unthinkable number earlier this year. The extra $100 per week has been an absolute lifeline to these Americans. But without additional action, it's set to expire in 2 weeks. This $600 not only has sustenance, it helped to create demand. The CBO report released this month showed that half of those receiving unemployment benefits in July are people of color. If Senate Republicans don't act and extend this benefit, they will continue to further the deep division in our economy along racial lines. The worst thing that we do now as members of the American family is to embrace any form of complaint. We are not on the other side of this pandemic. We need to provide another round of checks to get money directly into the pockets of those who need the support the most. These lifelines help families who have lost their regular sources of income afford the essentials of life, avoid eviction or homelessness. These programs and initiatives are not luxuries. They're these that are keeping families and workers safe and healthy while patching our economy as best we can. It's becoming more clear every day that we have a long way to go to safely return people to work, to provide them with the confidence to go back to work. Americans need additional help in the meantime. Senate Republicans have been sitting on the HEROES Act the last 2 months. There's no more time to wait. This is cruel to do this to the American family when they're trying to plan for what the fall might look like. Millions of Americans and the future of the economy are depending on them to act. So thanks to the Speaker for her leadership. Again, we need to reject any form of complacency in this atmosphere. Madam Speaker.
Thank you very much, Mr. Chairman. I thank you for clearly pointing out how interconnected all the aspects of the HEROES Act are in terms of direct payments and unemployment insurance being a stimulus to the economy, because people need that money. They spend it directly. They inject demand into the economy. They create jobs. And also the interconnection of the health and well-being of the American people to our opening up that economy. Thank you. And Mr. Scott, thank you also for pointing out the connection between the Education Stabilization Fund and all that that does to help our kids and getting to school, but also the importance of the funding for state and local government, which runs by and large, our school system provides more than 90% of the funding for schools, pays our teachers, and again, all the ancillary services, whether it's transportation to school, whether it's, again, the teachers, the custodians, and the rest, as well as food, sanitation, public first responders, and the rest. So with that, I just want to say the following. This is how many times have we had to say in the course of this pandemic, we are at a critical moment. We really are at an even more critical moment now, because we know what the answers are. For 2 months now, we've spelled out a strategic plan in the HEROES Act, because in the other funding that we had put forth with testing, the administration did not follow a strategic plan. In fact, they didn't even spend some of the money in a way as was designated by those bills. So we were very specific, and one of our chairmen, who isn't here but was very much a part of this, Frank Pallone, the chair of the Energy and Commerce Committee, was instrumental with his putting forth that second pillar, open our economy, testing, tracing, treating, separation, etc. So I thank him for his leadership in that regard, and he used a letter to the Secretaries of Defense and HHS asking where's the money that we allocated so far for the equipment. But we can talk all we want about testing, tracing, etc., but if we don't have the equipment, people are standing in line, or their cars are in line to see whether they even will qualify to be tested. And we need to know the extent of the pandemic in order for us to take the caliber of the necessary And we need to know how communities of color are disproportionately affected by this. If we're going to have the proper testing, tracing, treating, we do that. But you have to have the equipment. You have to have the equipment. So we're saying to the president, Mr. President, get us the equipment. The Defense Production Act require PPE, personal protective equipment, not only just to open up the schools, but to protect our heroes, our healthcare workers, whether at the state and local government or privately. PPE, we need it. Why don't we have it? Because you will not, for some reason, implement the Defense Production Act. Why don't we have enough equipment to test appropriately and to be able to make judgments on those tests as to whether positive and negative, rather than waiting 7 days to find out one way or another when the result is practically obsolete one way or another because it is so late. 24, 48 hours, that should be the extent of it. There is an answer. There's a plan. The resources are designated in a very appropriate way, but we need the equipment, and we can't have it unless the president implements the Defense Production Act. I also just want to point out that, again, families across America are very concerned. That has been said by distinguished Chair Scott. Children want to go to school. We want them to learn. We want them to socialize. Teachers want them to be in school. Parents want them to be in school. But we cannot risk their health and safety, and indeed their lives, or the lives of anyone that they might bring this home to. Our teachers, our custodians, our people who work in public schools need to be protected. So the point is that we can't follow the attitude of this administration. If you don't open up, we're not giving you money. No, we're going to give you money so that you can open up. It's in the HEROES Act. And we can't follow the lead of the Secretary of Education, who said, why shouldn't children take risks? Astronauts take risks. Oh, really? Well, maybe when they're an astronaut, they will decide to take that risk. We have to decide for them that going to school is not a risk to their health and to their safety. With that, I'd be pleased to take any questions. Yes, ma'am. Well, I think you have seen the public evolution of their thinking. When we first passed this, they said, there's no way, never, we need a pause, it's too much money, and all the rest. Now we've passed the June 30th deadline for state and local governments to carefully prepare their budgets. We are getting, sadly, approaching the deadline for the expiration of the employment benefits. This is really important. Imagine the uncertainty in households across America now who depend on the unemployment insurance because through no fault of their own, they have lost their jobs because pandemic, and they have to wait and see what the Senate might decide. But anyway, they went from 0 to now 1.3. That's not enough. We need more. But we see the public evolution of their thinking. At the same time, the Secretary of the Fed has recommended to Congress that we recognize the role that state and local government plays in our economy and the jobs that they create and the, again, demand that injects into the economy. The Secretary of the Treasury has said that we need to do more. Both of them indicate that the economic downturn can be much worse if we don't act in a very serious way now. So they've made some, one or the other, there's a recognition that there's going to be a bill. Let me just put it that way. Yeah. Yes, ma'am.
Is there any openness on unemployment insurance enhanced benefit to do something that's not $100 per week, perhaps? Do you see a compromise there with Republicans that maybe it's $300 or $400 or $200?
Well, you know, it's interesting because that you know, we have the pillar of honor our heroes, open our economy with testing, and that pillar is about putting money into the pockets of the American people. One piece of it is unemployment insurance and the benefit you are talking about, and another is how we put direct payments into a family, $6,000 to a family of 5, desperately needed by these families. Again, spent immediately, injecting demand into the economy, being a stimulus. So we'll see what that entire package looks like. Yes, ma'am.
Speaker Pelosi, but following up on her question, are you being included yet in this conversation?
Not a question of included. We put our marker on the table. It's very disciplined. It's nothing more than we need, although I must say we may need more for education now that the president is making the demand that he is making. So it's not a question of who's included. It's a question of the American people requiring this. Democrats and Republicans and school government across the country are weighing in on this in a major way. We think it's going the right direction. Yes, sir.
Would you be willing to see the money for schools being contingent on them reopening? And separately also, would you be willing to see Congress go on recess for all House bill being on the president's desk?
No and no. So your first question, I think money to schools being contingent on their opening? No, I think their opening is contingent on their receiving money, but not money as a threat, money as a precaution. Protect the children, to have the spacing, smaller classes, more teachers needed, more personnel therefore across the board needed in a way that is safe for our children. And no, I don't think we can. We have to have a bill, and we will have a bill, and hope we will have it sooner rather than later, because people really need to have it, and we should before the expiration of the unemployment insurance. Yes, sir.
On the question of unemployment insurance, Democrats have traditionally viewed that as an effective form of stimulus.
Yes.
On the other hand, Republicans say that it's unfair or inappropriate to have an unemployment benefit exceed somebody's previous paycheck. So you're really going to butt heads over this. How much of an obstacle will that be, and are you going to go to the math with the $600?
Are you associating yourself with the previous question? I think I answered that question. I don't have any intention of butting any heads. If we butt any heads, it's going to be over the safety of our children. You know, my whole purpose in politics are the three most important issues facing the Congress: our children, our children, our children. And that's where I butt heads. That's the hill I fight on. We will... You know, it's so funny to me when you talk about $600 versus $400. They had no hesitation to give 83% of the benefits of their tax scam to the top 1%. We believe, as Democrats, that when there is an intervention that is needed, a public intervention that is needed, it should be used in the most effective way, that where it is most needed and where it's going to have the most stimulus for the economy. And in that third pillar, we have the unemployment insurance, the boost, because this is a highly unusual situation, and some would say unique. Secondly, food stamps, which are a big stimulus. And by the way, they have resisted that, while people are in long lines in cars going to food banks that they never ever thought they would be going to. And there they are. In food bank lines, and the Republicans in Congress are like, they reject it. In one bill, we had some food stamp change. This time, we have it more so, and they have resisted that. Hopefully, what they see in their own communities will touch their hearts, and they will understand that even middle-income families are not able to put food on the table in the present economic situation. So again, all of that is... Most economists, when you're doing something like this in a situation like this, put the money where it is needed most, because that's where it will be spent first, injected into the economy, creating jobs, a stimulus. And so we'll see how it goes with the conversation about that, but some of it depends on what they're willing to do on the direct payments as well. This isn't about government and philosophy or any political differences of opinion. This is about meeting the needs of the American people at the time of a pandemic that has lost about 40 million jobs, that we have had the 16th straight week of unemployment benefit requests exceed 1 million per week, 16 weeks. This is about a terrible threat health-wise that has an impact on the economy and on our schooling as well. So we have to think big, and you can't solve the problem unless you have the tools to do so. And that's why the president has to answer for his delinquency in not implementing the Defense Production Act to produce the equipment so that people can take the test and that the test can be analyzed 24, 48-hour period, not wait a week or longer to find out whether they're positive. And by then, they have to get tested all over again because the information is obsolete. Yes. Excuse me, if you have to take it off, but just talk slower, please.
One of the things that wasn't included in the HEROES Act was the issue of liability protection.
That's right.
Where you're seeing compromise with the Senate on that.
We think the most important way to protect our workers and our employers and customers and clients of businesses as well is to have a strong OSHA provision in the legislation. We tried that with the very first COVID bill. All along we've tried to have that. They have resisted that. But just think of it. If you have OSHA standards that say to an employee, if you do this, that you must do this, 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 and this to protect your workers and your customers, clients, whatever. And they do that. That is their protection. It's their protection. It's the protection of their workers. It's their best defense. It's a far better solution than saying to workers, you're an essential worker. You have to go to work. You won't get unemployment insurance if you don't because you're an essential worker. And by the way, we're not implementing any OSHA provisions, not the ones that exist now, or enhanced one, which we are not agreeing to. So if you get sick, you have no recourse. That just isn't fair. Okay, no, you had one. Any others without a question? Haven't had a question? Okay, I really do have to get back to my day job. I thank you all for being here at this time. Every day that goes by, the anxiety deepens in the households of America. The kitchen table concern about how they're going to pay the bills, how they're going to put food on the table, are they going to be able to send their children to school? Are at risk of being infected, and what does that mean in terms of transmission to other members of the family? What are we disconnected from that we understand there are solutions? And if you want to know 4 words on how to solve it, science, 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 and science. But instead, we have an administration that ignores the science and dislikes the governance that goes with it. The science tells us that this would be the best path, but you don't want to exercise any standards from a governmental standpoint. The American people, the virus continues. We are at a moment, if we don't recognize that, it's going to be even worse, and we must prevent it from being. We can beat this. We're Americans. We're the United States of America. We see other countries solving this. We can do that. We can do better. But we have to decide to do it. It's all a decision. The president can make, in one respect, by deciding to implement the Defense Production Act, or else answer for it. Why aren't you? Why aren't you anticipating the need that we know we already have to a great extent for the equipment, for the PPE, equipment in every way, and even more that we're going to need, if God willing, soon, and we pray that it will be true, that there's a vaccine or cures and the rest. What are the syringes, the vials, the equipment that is needed to convey, to minister to the needs of people with that vaccine? We've just got to be thinking way ahead. And that's what we do in the HEROES Act. We hope that within the next couple of weeks, it will be the law of the land. Thank you all.
All right, everybody, again, that was Speaker Nancy Pelosi there. She said she's got to get back to her day job, trying to crack jokes there while speaking about the HEROES Act in our nation's capital. Hello, Pilar Arias here. It is hump day. It is Wednesday. I can't believe how quickly this month of July is going by. We're already halfway through it. It is the 15th. I hope you all are having a great day, great afternoon, wherever you are watching us from. There's currently 1,715 of you watching on YouTube and many more watching on coronavirusnow.com. It's been a minute since I've shown you the coronavirus numbers from Johns Hopkins University. So here they are, the latest from the website right here in the U.S. 3,465,031 cases reported. Unfortunately, here in the U.S., we've lost more than 136,000 people, reaching that 137,000 mark. And when you're looking at the hardest hit states, the hardest areas, you've got New York, New Jersey, Massachusetts, Illinois, California, Pennsylvania, Michigan, Florida, and Connecticut. So we are staying on top of all these updates all across the country for you right here. We bring them to you as they are live. We bring them to you later on in the day as well. We stay on top of them as best we can. You got me, Mike, and Christy 24/7 on coronavirusnow.com and 14 a day right here on YouTube. I've been waiting to see if they're actually going to have a news conference here in the Bronx in New York City. This is at the mural painted, the Black Lives Matter mural. They do have a podium set up there, and it looks like it could be getting underway any moment. When and if it does, I will probably take you there live. Meanwhile, let's stay in New York City. Look at the New York Stock Exchange, Dow Jones Industrial, big board, nothing but green today. Stocks looking pretty good. They're up about 110 points, hovering pretty close to that 27,000 mark. Still nowhere close to how great we were doing prior to the pandemic hitting, but not looking bad either. Again, I hope you all are having a great day. We're staying on top of all these coronavirus top stories, breaking news updates for you from across the country. I'll take you out to Austin, Texas here next, where their public schools talked about whether or not they can reopen and what their plans might be.
Good morning. I'm Kalili Bien, and I will be the moderator for today's media availability. To start, Austin Public Health Director Stephanie Hayden will first say a few words, followed by Dr. Jay Gitt, Austin Travis County Alternate Health Authority, who is filling in for Dr. Mark Escott today, then Austin Public Health's Chief Epidemiologist Janet Pichette. And then we'll open it up to the pool reporter who will ask questions from the media. Stephanie, over to you.
Good morning. Thank you very much. I wanted to start today to talk about COVID-19 deaths. In Travis County, we have 179 deaths. What is very concerning to me as the health director is that these are individuals. These are individuals that have experienced, whether it was being at home or being hospitalized, they have gone through this as well as their families. We want to always keep in mind that during this process, there is a notification process that happens to the family, but our staff have to follow up with them to talk with them about contact tracing. I would like to take a few minutes to just really pause and pay respects to the individuals of Austin Travis County that have lost lives. Let's take a few moments of silence. Thank you. Thank you for that opportunity. We want to talk about personal responsibility today. As you are making plans to cover the essentials of your household, whether you're an individual or a family, no matter how large or small, working and making sure that you are taking personal responsibility for your actions. Also, if you are a parent or caregiver, making sure you are also being an influence, a positive influence. As we look at this response of COVID-19, Austin Public Health and all of the city and county and all of the hospital staff and everyone that is working in this space, we need you to help us and take that personal responsibility. We are looking forward for you to be an ambassador. We may not ever hear about what you've done, in the community for your family, but just know it is going to help us to flatten the curve. Put up some community testing sites because it is important for us to have facilities where we are able to test in the community 3 days per week. At this time, I will turn it over to Dr. Jason Pickett.
Director Hayden, thank you very much. And to echo what you've said here, it is the individual action by each person that helps to save lives and prevent the spread of this virus. It is not the testing or the contact tracing or the case investigation, but it is what we as individuals do to prevent the spread by wearing masks in public, by staying away from large groups of people, by washing our hands, by social distancing. It's those things that each and every one of us does every day that helps to slow the spread of this virus. We have a little glimmer of hope in this week's numbers where we've seen a slight leveling off of the hospitalization numbers. Where we were on a rapid increase, we've seen that plateau slightly just over the last few days. It is difficult to say if that is going to remain or if we are going to continue on this upward trend. The hospitals right now are stretched and they are pulling staff in from hospital areas and contract staffing to increase their capabilities. But now the hospitals are stretched with patients and looking for help from the state and from their other hospitals as well. We too are requesting those resources from the state on behalf of the hospitals, and we are also standing up our alternate care site, our field hospital, if you will, to help take some of that burden from the hospitals to help them to care for more patients, especially those who are critical. But I want to say that this leveling off is very early right now to tell if this is going to be a trend or if we're going to continue on the upward trend that we have been seeing over the past couple of weeks. We have looked at and now enacted an additional order as it relates to schools, and we have.
We're all about live here on News Now, everybody. We just got the Michigan Governor Whitmer live. I'm going to take you there now on News Now.
When we're out and about and there are crowds, when we're outside even the president has started wearing a mask. And I'm grateful for that. That's why I wanted to highlight that. Wearing a mask can significantly help our economy. A study conducted by Goldman Sachs concluded that a federal mask mandate, that's if everyone in the nation had a mandate like we have in Michigan, adopted in Alabama today. If everyone had that, we could save the U.S. economy from taking a 5% hit to our GDP. That's massive. So if Michiganders don't mask up when we're going out in public, cases could rise and we'll be forced to close down more of our businesses, including auto manufacturing plants that employ thousands of Michigan workers, jobs that our whole economy depends on. I've said it many times before, but a second wave of this virus could be absolutely devastating. So we can lower the chance of that second wave or the breadth of it or the intensity of it by simply wearing a mask now. So speaking of small businesses, Martin is here today to talk about the Michigan Small Business Restart Program. While business is reopening, the impacts of COVID-19 are still creating incredibly difficult situations for small business to overcome. From lost business and revenue to increased costs associated with providing adequate safety measures for employees and customers. And why I signed into law the bipartisan supplemental budget that directed $100 million of Federal CARES Act dollars to the Michigan Strategic Fund to implement the Michigan Small Business Restart Program. Now, these grants, up to $20,000 each, will support Michigan's small businesses and nonprofits that are reopening but have experienced a loss of income as a result of this crisis. As of this morning, small businesses and nonprofits can submit their application for restart grants through a single statewide application at michiganbusiness.org/restart. There will be a 3-week application window, And then all applications will be provided to the 15 local economic development partners that will administer the grants for a particular region. As we work to continue to ensure COVID-19 relief resources are benefiting all small business in the state equitably, 30% of grants awarded under this will be going to minority-owned and women-owned or veteran-owned businesses. We know helping these businesses thrive is critical to bringing more economic prosperity overall to populations that often remain underserved. The Michigan Agricultural Safety Grant Program application also went live this morning at michiganbusiness.org/ag-safety. This $15 million grant program will help our farmers and food processors in the state access PPE, testing equipment, training for workers, and housing solutions to ensure social distancing to protect our workers in the food supply here in Michigan. Together, these two programs put federal funding to work for small businesses in Michigan, businesses that have been hardest hit by COVID-19, helping ensure that they can keep their doors open and put critical protections in place for their workers and their customers. Families across the state depend on Small Business Restart Program, particularly by building on families across the state depend on small businesses for their livelihoods. The Small Business Restart Program particularly will build on additional COVID-19 business relief efforts through the MEDC to create a strong foundation for Michigan's long-term economic recovery. So I appreciate the speed with which the MEDC was able to execute these programs to ensure that dollars could start getting into the hands of small businesses as soon as possible. In just 2 weeks, both the Restart grants and the Ag Safety grants went from words on a page to 2 fully operational programs accepting applications now. This is the urgent know-how that we are approaching all economic recovery efforts with in this state. The leadership of the MEDC in coordination with other key state agencies. So I know that people are anxious to return to normal, especially where our economy is concerned. The reality is that true, lasting economic recovery is only possible through public health recovery. That means we need everyone to do their part, to continue following guidelines driven by science and mask up. This is going to be a team effort, but Michiganders know how to get things done. Pushed a curve down before. We have led the nation. We are capable of this. If everyone does their part, we will be successful. I know we can continue to lead this nation, but we got to mask up to do it. And with that, I'll introduce the Lieutenant Governor Garland Gilchrist.
Thank you, Governor. And I also want to acknowledge Dr. Jonet Khaldun and Mark, who are here joining us for remarks here in a few moments. You know, when we see the daily cases of coronavirus and the deaths that we're seeing compared to other states like Texas and Florida, it's easy to think that even while Michigan is experiencing an uptick, that, you know, we're doing okay, that we're out of the woods. But we're not. I talked about earlier, I've lost 23 people to COVID-19. These are real people. These are people who have stories, families. They have legacies that they were building that were cut short. It is long overdue that we do something about it. And these are people like, you know, an assistant pastor at the church that I grew up in. You know, a cousin down south who was the oldest living member of my family, my father's side. A Michigan legislator, talking about Representative Isaac Robinson, and others. I think the governor said it really well last week when she said, like, I don't care what's on your mask. You can wear a mask. I hate wearing masks. I just care that it's on your face. We need everybody to step up. Wear a mask. Wear a homemade mask. Wear a mask with a pattern. Wear a mask that reminds people of the greatest university of the world.
I am.
Wear a mask for the other school. You know, everyone needs to step up. I mean, to use an analogy, we strap a piece of cloth across our chest when we get in a car to prevent loss of life. Now, all we're saying is that if you strap a piece of cloth across your face, prevent people getting sick and people losing their lives. You know, most of the times when I speak, you hear me using a phrase, stand tall. Stand tall for Michigan. Stand tall for whatever I'm talking about. I don't say that just because I'm 6'8", even though Coach Izzo told me I was 7 feet, which I'm great about for a really long time. It is a reminder. Stand tall means to be proud of doing the right thing. We can all stand tall and do the right thing for our friends, our family members, our neighbors, our co-workers, and our communities when we mask up for the state of Michigan. So let's all stand tall and do that together. With that, I'd welcome here to the podium Dr. Joneigh Khaldun.
All right, so go blue. Thank you, Governor, Lieutenant Governor. So today we announced 71,197 cases of COVID-19 and a total of 6,085 deaths here in the state of Michigan. We had 891 additional cases that were reported today. So that's very concerning. Overall, over the past few weeks, we've seen increases in cases across the entire state, which again is very concerning. But each region looks a little bit different. I'm going to talk a little bit about that. The Grand Rapids region has our highest rate of cases at 53 new cases per million people per day. The Kalamazoo and Detroit regions both have over 30 cases per million people per day. Saginaw, Jackson, Lansing, and the Upper Peninsula have over 20 cases per million people a day. And for the Upper Peninsula, cases have been rising for 6 weeks, and this is the highest rate that they've had during the entire outbreak. Traverse City also has over 50 cases per million people per day, with cases steadily rising over the past 3 weeks. Overall, and this is good news, we have significantly